welcome to the meeting. We will let people in as they join, but for now, we're going to continue with the meeting. Today's agenda is a bit different. Our speaker can only join at 3 o'clock, so we are going to continue with the minutes and the portfolio feedback, and then Lindy is going to present a back to basics. After that, then Dr. Casper will join us for his presentation about AI in occupational health. I have posted small new minutes on the WhatsApp group. There's a few small changes, just a few lines that I had to take out that was duplicated. If is there somebody who can accept the minutes for us? Just raise your hand. Thank you, Beverly Butte. Petronella, can I mark you as a person who seconded? Petronella McLean. Thank you. So Beverly Butte accepted and Petronella McLean seconded. Thank you very much. Okay, I'm handing over to Beverly Butte. Hang on a moment, let me make you a presenter. She's going to provide feedback to us on the workshop. Beverly, you can unmute and speak.
Okay, can you hear me?
Yes, we can hear you.
Okay, brilliant. It's the first time I'm doing this, so I'm quite nervous, but anyway, let's go for it. So I was very grateful to SASOHN Western Committee for the opportunity to attend the workshop. Besides seeing old colleagues again, I enjoyed visiting the exhibitors, some of whom I have known over many years, and it was great to reconnect. Something I was not aware of is that in talking to one of the representatives, I should tell you the company's name, Expert Laboratory Services. They specialize in, amongst other things, in doing saliva drug testing and urine drug testing. And so what was very interesting to me is the saliva drug testing is very useful for companies where they need to test their employees before they actually go on site. And then if they should test positive, then they can go off to the clinic and the sister can retest them. But one needs to remember that if you do a saliva test at the entrance before they enter the premises, then at the clinic, the sister needs to follow up again with a saliva test. If you do a drug urine test, the 5-panel, the 6-panel tests that we are more familiar with, that test you follow up again with a urine test. So that was something that I didn't know. So you can't interchange. So, and then also I want to congratulate the committee on an excellent event in every respect. You can all be very proud of your contributions you make on behalf of the SASOHN members. And I think Western Cape, we are extremely privileged to have very capable people, and that the committee or the members are in the safe hands of a very capable committee. So well done. I'd like to make special mention of some of the things that happened at the workshop. The one was the game Kahoot IT, which was led by Natalie Copeling at the start of the workshop. Once again, I'm reminded that IT is definitely the way of the future, and that's something I need to give attention to, is updating my skills. And really, I seem to spend my life on the computer, but there seems to be so much more I need to do and find on the computer that is out there available for us as practitioners. I was simply blown away with what is actually available on the internet. And so the game turned out to be fun, interactive, and quite proud of myself that I could answer all the questions correctly, although the program was a bit lagging in recording everyone's answers at the same time because you had a time limit and you had to be very fast. The icebreaker that was led by Lindy was also a reminder of the importance and the weight that we give to instructions and in listening. Then all the other speakers were excellent in their presentations, and each presenter brought a different dimension to cover the aim of the workshop. Some of the take-home messages for me were: stay within your scope of practice. The focus on fitness to work remains job-based and ensuring our employees are fit physically, cognitively, and emotionally, and being able to work safely. Knowing the primary healthcare history can be valuable with ongoing medical surveillance of risk-based health monitoring. And I think you alluded to that, Jeanette, in one of your previous newsletters. The legal team was a reminder of all things legal in our field of practice and the emphasis placed on informed written consent. Prof. Adams highlighted the need for defining job descriptions for an employee in leading up to fitness to work assessments. Dr. Hubert, who's our speaker this afternoon, he sensitized the audience to the introduction of AI, ChatGPT, and other portals available to assist with the drawing up of reports and clear workplace assessments. This is truly a game changer, with everyone being pressed for time in their daily work. Dr. Hubert also gave the basis of corporate governance and said that everyone has the right to an environment that is not harmful to their health and well-being. So that is my feedback in a nutshell. And I'm truly indebted to the SASOHN committee again for making sponsorship available so that I could attend the workshop. Thanks, Janette.
Thank you, Beverly. That was a very comprehensive feedback. We appreciate it, and I'm glad to hear that you enjoyed the workshop. It was fun for us too. Okay, let's move on to the next slide. Adele, you can present the finances. I hand over to you. Just for the members, if you see this at the bottom where it says the Teams logo and chat, I've posted it, this specific slides information on the chat. So just scroll up right to the top, then you will see everything there.
Okay, hi everyone. Our financial statement as it was on the 19th of August is the closing balance of 223,300 and 14 cents. And then I thought, let me just highlight the expenses, income and expenses for the month of August. That's not on the screen in front of you, but sometimes if you see this, it doesn't really make sense. So let me just mention that we had spent for speaker gifts 350. That was for the speaker at the mental health workshop. We had meeting and workshop expenses of more than 37, almost 38,000 rand. That was for the venue as well. And then we've had exhibitor income for the month of August is 7,800. And then the income for the workshop was 26. So if you think about the expenses for the workshop and the income, then the exhibitors are making a huge difference for us. So we say thank you to them. And then we also had like a 50% of the last few members that joined SASOHN, which was a 1,290 rand. And so the total was standing on the 19th as closing balance of 223,314 cents. That's it. Thank you, Annette.
No problem. Can we have one committee member approve the report, please. Anybody? Jenny Turnbull. Thank you, Jenny. She approves the financial report. And then Laurentia Turner also had a hand up, if you don't mind to second that. Thank you very much, Laurentia and Jenny. Then we can move on to the marketing report.
Okay, so yes, with the marketing, we once again just want to highlight our exhibitors, Pascal, SSEM, Software 1066, Incon, Economics Direct, Prismia, Amtronics, Lancet, and Expert Laboratory Services. Amnitron also pay, but unfortunately, due to illness, they could not attend. And then I just want to make a small comment mentioning MED, our exhibitor, his name is Dan, sadly passed away due to illness in hospital. And we will surely all remember him as such a vibrant, young, and wonderful, wonderful young man. So yeah, that is all for marketing. And then once again, if you know of any company that we can approach that has not been to our workshops, please let me know which service providers you are making use of. Yes, thank you, Janet. Janet, done?
Sorry. I forgot to unmute myself. I've posted a picture of Dan in the chat, just so that you can see what he looks like. It's a very sad situation, but anyway, we will remember him fondly. I'm handing over to you, Beverly.
Good afternoon, everybody, and thank you, Yonette. Social responsibility. For this year, we chose an initiative, the Family Shelter, located in Somerset West, Cape Town. And it's operated by dedicated social workers. And the shelter provides support and rehabilitation to individuals referred there, helping them reintegrate into society through tailored care and assistance. And the shelter also relies entirely on donations to operate. Your donations, clothes, linen, toiletries, baby clothes, food, everything is via donations. And we've consistently highlighted this project during all related meetings, and very pleased to report that we received a generous donation on the day of our workshop on the 8th of August. And we in celebration of Women's Day, and we made collections especially for the women. And I'd like to thank all our members who donated at the Kaleidoscope on 8th of August. And these contributions were received with such sincere appreciation and big smiles on the recipients' faces. Thank you, Yonette.
Beverly. I'm going to quickly play a clip for you. Please let me know if you can't hear it. It is soft, so just make the sound on your computer a bit louder. But this is one of the residents in the shelter. Thank you, Beverly, for recording
Pleasure.
that. The next slide will just give you more information. I just want to point out Beverly and Dorothy visited the family shelter again on the 14th of August to deliver all the donated goods. They went there in July and again in August. So thank you for that, Beverly and Dorothy. It's really appreciated. There's your next slide.
And it is only our new project for will be the Somerset West Family Shelter. It's, like I said earlier, it's a one-of-a-kind NGO, and the families are referred by the Department of Social Welfare or social workers. And they come from all over the country where they are referred there. And the families allowed to stay up to 1 year and help back into society. The shelter survives on donations like linen. When they move out of the shelter, the linen and clothes will go with them. So they keep needing, to have that replenished. Toiletries, face cloths for the ladies, and nappies and food. There's a creche with 13 children currently on site, and they are taken bus to school on a daily basis. So to contribute, you can donate clothes, clear out your wardrobe and make space for new, linen, toiletries, face cloths, nappies, food. You can call your caregiver or just put it on the WhatsApp chat, and we can make some arrangement to collect and go and deliver to the shelter. So yes, a big thank you to you ladies for all the donations that you have given. It's very much appreciated. It was really overwhelming to listen to that young lady that was so willing to talk, and she also showed us her room where she lives. So thank you very much again. Over to you, Joannette.
Thank you, Beverly. Okay, I want to quickly talk about the newsletter. We are always looking for contributions. So I'm going to wait for it to come around again and then I will stop. Anything that you want to share, news, events, fun stories, case studies, things worth celebrating. If you had health days at your site, you've got nice pictures, please share that. Any contributions to your social responsibility, any photos you would like to share. The next newsletter is due in November, so if you've got something to contribute, you are welcome to send it to me before the end of October. It takes me a whole day to do the newsletter, so it will be great if I can receive it in time. Thank you to those who contributed already. The guidelines, we have done one of them. I can't remember, it was the establishing of an OH clinic. The other two we haven't started yet. There are a few people who indicated that they want to be part of it. My apologies, I haven't gotten back to you, but we will do that. Salary survey is ongoing. We are exploring ways on how to do this. I would really encourage you, if it comes out, to take part in that. There's a new bill, they call it the Fair Pay Bill, that has been proposed. It's not yet signed off at Parliament, but it is a standing bill, and that bill will force employers to take out clauses that forbid employees to share their salaries, even with other employees. It's to encourage fair compensation. So once that comes out, there's really nothing your employer can do if you do declare your salary. The survey will definitely be anonymous. We will not be able to trace it, and we think of doing it through a third party. Dr. Karen Michelle is helping me with that. She was involved with the original salary survey. So this will be done very professionally. I really encourage you to take part when it does come out. The academic day, the theme is Christmas in Winter. It's planned for May next year. Dorothy, I can't remember the exact date. Can you tell us what the date is? Dorothy?
14th of May.
14th. Okay, wonderful. There she posted. 14th of May. Thank you. And then you will see below, I've inherited the SABInet portfolio at Exco, which I'm very grateful for. Now I can include all the new updates in the newsletter. The updates that I provided at Exco a few weeks ago was from the beginning of the year, so it was quite a lot. I couldn't fit all of them into the newsletter. So I just provided a link to the presentation. Here it is. I also put it in the chat for those of you who want to see it. It's just a summary, and I asked Copilot to help me compile the summary, and I also included a reference for Copilot. So you are welcome to see what it is all about. It was really quite interesting to do that. And then the AGM will be hosted by Pathcare. They will provide us with the venue and the snacks. Thank you, Pathcare. Thank you, Cheryl, who's in the meeting. You are very valuable to us. Always come to our rescue. We really appreciate it. The AGM is on the 17th of September at Inktaka Island, the activity center. I confirmed that it's also called the Environmental Education Center at Century City. If you type in Inktaka Island Environmental Education Center, it will take you right to the front door. It's scheduled to start at 1 o'clock. Please, you can start arriving as early as 12 o'clock already. We will be setting up and making sure everything is ready. And we've got two very exciting speakers planned. Lindy will tell you all about that. Please register an RSVP for this. If you missed it now, if I move on and you haven't scanned it yet, it's also pinned in the chat. So you can just go up and open it and scan the QR code. The link to the forms is also in there if you can't scan it. We really urge you to attend this. You are not going to be sorry. And then Dorothy, as always, thank you for your hard work. She works very hard behind the scenes. Her portfolio doesn't require her to give feedback, but we still appreciate what you are doing. Thank you. Beverly is our new committee secretary. Thank you, Beverly, for your hard work as well. The two secretaries have a lot on their plate, and we really appreciate what they are doing. Just shortly, a reminder again of the caregivers. It's on the WhatsApp group. There it shows what it looks like on the WhatsApp group. It's under the description and also pinned in the Teams chat. If you want to know who your caregiver is, go to the letter that represents the first letter of your surname, and you will see the name of the person who you can contact with with regards to any problems or any questions that you have. The SWOT analysis is open again. There's the QR code and the link to join. It's also in the chat. We really rely very heavily on your feedback on how to or what to include with our program for next year. Sorry. We plan our strategic planning session for early October, which is a few weeks away. So we've got limited time for people to give us feedback on what they want to see. I made it easy for you this year. I pre-populated quite a few topics, and you can choose from them. There's a maximum per question that you can choose, but choose the ones that you want to know more about, and then we will go with a majority vote. If there's something that's really interesting, we can include that too, but this is your opportunity to tell us what you want, what do you enjoy. If you have any suggestions on how to make the meetings or the workshops more interesting, we would definitely want to hear about that. So please make use of the SWOT analysis. We hope to get more than 18 members to take part in this year. We really want to know from as many of you as possible. Thank you for that. Even if you're not a member of the region, you can still complete the form. I know that there's members of other regions that usually attend our meetings, and we want to know what your needs are too. Okay, Lindy, I hand over to you. You can share your screen if you have to have something.
Okay, thank you, Joannette. Okay, guys, good afternoon. I hope you all are doing well on this Wednesday afternoon. So because our speaker is only available from 3 o'clock, I decided to give some educational feedback and then do a little bit of back to basics on the new NER, the noise exposure regulation. So let me see, am I sharing? Not yet. Let me first do the feedback.
Thanks, we can see.
Perfect, thank you. So as Joannette said, we have the AGM now in the 17th of September. Because of the queries we have on the new noise exposure regulation at the AGM, I will be sharing more in-depth discussion and implementation on the NER. And we also have a Professor Dion Els that will come and talk to us on emotional intelligence. I also do know that Dorothy is planning a special surprise for us, so we're looking forward to be spoiled at Intalka. So please, guys, register for that face-to-face meeting, and yeah, then we'll see you there. Then October, we have diabetes in the workplace, and the back to basics will be foot care. November, we don't have any general meetings or workshops or anything because it's a national conference at KZN Coastal that is hosting it on Surfing the Waves. So if you have not yet registered for that, there were mails sent by head office with regards to the conference. Then quickly on the health calendar for September is Eye Care Awareness Month. So maybe something that we can focus on in our clinics. There's also a World Retina Week on the 22nd to 28th of September and the World Retina Day on the 28th of September. We also have Heart Awareness Month if you rather want to focus on that. And the Heart Day, World Heart Day is the 29th of September. And there's also the National Month of Deaf People. So it's always, if I ask people, what would you like to be, rather deaf or blind, it's a toss-up, okay? And now we can focus on both of them for September. And I must say, most people say they'd rather be blind than deaf. Right, then upcoming courses, the Health Science Academy, we all know they've got an audiometry course virtually, 2 to 4 September, spirometry, end of October in Pretoria. And then there's a vision course that's also virtually in the middle of September. They do offer dispensing courses for healthcare practitioners. And then they do have refresher courses on all audio, spiro and vision on demand and online. But they do have one planned for Monday, the 1st of September, and spiro on the 27th of October. EFHA, as you all know, they have audio, spiro and vision course every except December. Their next audio refresher course is planned for the 6th of November. The vision, the 4th of September and the 4th of December, and the reproductive health refresher, the 18th of September and 2nd of December. And the spiro refreshers over 2 days, 7 to 8 October. August workshop. It was approved yesterday. I got the numbers this morning, so I will be sending out your CPD certificates for all who attended the August workshop. I hope to do it over the weekend. And then just a note that CPD has not yet started by SANC. So we don't need it yet, but we are being proactive in getting ourselves geared to run with the CPD points. Legal updates, Department of Employment and Labour updates. I think Joannette has covered it with the Sabinet. Thank you, Joannette. Right, and then, yeah, we've already talked about the AGM at Intaka Island Activity Centre. So there's the 3 questions. I see that, Joannette, thank you. You've put it on the poll on Teams, if you can just answer it. The first, have you read the new noise exposure regulation? It's dated 2024, but it came out on the 6th of March this year. Then have you aligned your current occupational audiometric testing with the new NER? And the last question is, have you done a refresher course in the last 5 years? So I say I must also answer the questions. It's on my poll as well. Let me answer it. Right. I see 38% of people said yes, they did a refresher course the last 5 years. Well done. So you would have been refreshed on the SANS 10083 that changed in 2023 was the latest version. And then the noise exposure regulation is then now the one that needs to be updated. So let's go back to some new basics, which Department of Labour has given us some information on. So before we start, I'm going to give you 1 minute. You can react on the chat and tell me, can you connect all 9 dots with 4 lines without lifting your hand while you're doing the drawing? Okay, so Janet, if you can help me, there's a couple of yeses. Can we unmute them, Janet? Mulamung,
Yes.
maybe
So
she was first. Let's hear how she will do it.
Molemoeng, I'll get to you just now. Okay, Molemoeng, you can unmute yourself. Let's try Danae. Danae Skuman, you're welcome to talk. You know how to do that. I mean the dots.
The dots, yes, thank you, Yannick. Danae, are you unmuted? Oh, we only have yeses, we don't have. Okay, there's a John Kluter, maybe if we can unmute him.
Okay, hang on a sec. I'll get there. I have to scroll through all the people attending.
Okay.
John.
No, we can't hear you. Danae also says she's unable to unmute.
Okay. John?
Good afternoon, everyone.
Hi, John. What is the answer?
I swear I just had it. Just give me a second to recollect. Okay, so 1, 2, 3, 1, 2, 3. I think I lost it just now. Maybe is there a way I can draw a sketch and then send it through?
Okay, put it on the WhatsApp group. Yes, then I'll have a look. Perfect.
Danae, I've made you a presenter. You are welcome to talk if you want to. Sorry, John, am I interrupting you?
No, all good. I'm still reconfiguring.
You must go back to the drawing board.
Danae, you're welcome to talk. Okay. It's all right. Let's maybe we can get back to that
Okay, so nobody can get through. Okay. Right, so let me show you how do you connect the 9 dots without lifting your hand. So you're going to start here at the bottom. You all can see my mouse. You're going to go up. That's line number 1. All right. Then you're going to go to the right. You're going to get those 3 dots. Then you're going to think outside the box. You're going to go past. So that's your second straight line. Now you're going to go down, across. You're going to get those 2. Again, outside the box. And then you are going to go up. And that way, with 3 straight lines, you can actually connect the dots. So I really love this picture because when I think of audiometry, in specifically in South Africa, we all know not only audio, occupational health as a whole has got very, very fragmented legislation, and there's a lot of parts that are still missing in our audio regulation. So the latest regulation, the noise exposure regulation, came out, and although I think it's a very good regulation, there are some questions we still have. And Warren Mallon from the Department of Employment and Labour said they've started a committee and they hope to answer our questions by November. So we are seeing these dots and we now need to think outside the box, connecting our dots to be able to service our employees and to keep them safe and protect their hearing. So the first thing that we need to note is that the name changed. Okay, so it's noise-induced hearing loss regulation was the old one. It's now called the noise exposure regulation, or the NER. And this is the table of contents. If you're going to look at the old noise-induced hearing loss, it's very similar, but there are very specific things that they've incorporated into this document. A lot of the information was in the SANS 10083, and they've added it in this regulation with the code of practice specifically. So that's something that if you have not yet read it, I just want to see what was the responses on reading it. Sorry, I just want to go up.
I'll
Half
tell
of
you
them,
now.
yeah, half of them did read it, about 45%. So that's great news. Right. So what I want to first just make you attend on is, and Dr. Casper has joined us, so if he wants to make a note, he can comment on it later. The definition of a competent person in audiometry has changed. So they say it is a person registered with the Health Professions Act and with the HPCSA. Is an ENT specialist, a speech therapist, and an audiologist. It currently excludes an OMP. The previous regulation stated an OMP. So under this regulation, it now states that an OMP must also do the audiometry course. They are not going to be called audiometrists in future, but I think that we are stuck with that name. That is how we know it. The SANS 10083 refers to the word audiometrist, no other legislation. And the NER is calling us an occupational audiometric screener. Right, so we're going to be screeners going forward. What they then also brought in is the noise action level. And I know that a lot of us, we know about the noise action level. It was always on 82 dBA. And they have now actually into the regulation. And they also added a peak noise level. So when you get your hygiene guy to come and do your survey, they will in future also include the peak noise level, and the moment it is 135 dBc for the impulse noises, that will also count as noise action level. If you read through the noise exposure regulation, you will see that they talk about, a lot of the places they talk about the noise action level is met with concomitant exposure to hazardous chemical agents as well as whole body vibration. In one of the webinars, the question was asked to Warren, when do we start the hearing conservation program? Is it 82 decibels with exposure to whole body vibration and chemicals. And he said, no, if it's 82 decibels, our hearing conservation program must start. The noise rating limit is still 85 dBA. And the DBC is then 137, so that is what was added. And then the definition, they talk a lot about medical screening in the NER. And just for our reference, medical screening means a risk-based, systematic medical assessment of a person or group of people using a combination of the medical history, physical examination, and then the special test or investigation to detect disease or abnormality. So when you read it, the NER take into consideration what they mean by medical screening. Medical screening is not the hearing test. Okay, it's the history, the physical, and then the hearing test with that. Here is the definition of an autotoxic chemical agent. It is something that has a potential to cause hearing impairment, either alone or in combination with noise. So even if your noise levels are less than 85 dBA, the fact that the chemical has an autotoxic component, you can have hearing loss. So when you do your risk assessment, please look at your SDSs and for your chemicals. Vulnerable employee, we all know a vulnerable employee, somebody who's at higher risk for injury, disease, or complications caused by the exposure to noise. This was also specified in the NER, and I don't think I need to tell you about the whole body vibration. So just quickly on section 9, which is the medical screening and the medical surveillance. And it puts a lot of emphasis back onto the employer. The employer must establish a documented medical screening program. So I don't want to go into the details. You all know this. But what I want to emphasize is the employer must establish it. It does not mean the employer must do it, right? The employer establish it by getting the services of an occupational health practitioner. And if you can recall, which I'm sure you can, under the Occupational Health and Safety Act, an occupational health practitioner is either the nurse or the doctor with a qualification in occupational health. So the employer must establish it by getting the services of the occupational health practitioner, which then also plays a role in the information of which we are managing for the employer. They say that in the case where the employer has to conduct medical screening, the OMP, this is now the doctor, must consider if employee has a health condition that makes this person vulnerable to noise. If the employer has a health condition that impacts the proper use of the HPD, the OMP must consider if there is an identifiable occupational disease or adverse health effect related to noise, if there's a reasonable likelihood that the disease or adverse health effect may occur under those specific exposure conditions, and if there are valid techniques to diagnose indications of occupational diseases and adverse health effect. So again, they have put a lot of emphasis on the OMP as well. So make sure your hearing conservation program, as we talked about the previous time, is up to date and incorporate what needs to be done and who is responsible. They say that where the need for the medical screening is contemplated as necessary by the OMP must specify the requirements. So the OMP will say, this is the risk assessment, these are the guys we need to test. So that is how we all are working. We do the risk assessment, we are a team from the employer to the hygienist, to the doctor, to the nurse, to the check officers, and the doctor said, okay, so because of the risk assessment, we're going to do audiometry, and part of that should be a medical, occupational, and exposure history, the appropriate clinical examination, and then the audiometry, and it's going to specify the intervals. So again, back to the guideline or the procedure. The employer must ensure again, the employer or the doctor, that includes an initial medical screening and then subsequent periodic medical screening. But you cannot test the person more than every 2 years. Okay, that's a maximum that you can see them at maximum intervals. And remember that there's a difference between an initial medical screening and a audiogram baseline or entry or initial. So with an initial medical screening, you're going to either do a baseline audiogram, milestone baseline, an entry, or an initial. And then your subsequent periodic medical screenings or health assessments as we know it, you will then do your periodics or your exit. So there are two new audiographs, but I'll touch on that. So after concluding it, the OHP must now ensure that the employer is informed in writing of the outcome of the employee's health evaluation if the outcome was normal. So as an OHP, we must now inform the employer that the health evaluation or the medical screening or the health assessment, whatever you want to call it, has been done and it is normal. It does not matter how you do it. They do not prescribe to us how we must give that information to the employer. So if you're doing a certificate of fitness and you are including the audio to say that this person is fit to work and you have done an audio that is, for example, good enough. But what I want to, our time is running out. What I want to focus here is that if there was an abnormal result, the OMP must notify the employer in writing by means of a medical certificate of fitness. So the moment you've got an abnormal result, the OMP does an COF, and it must be according to the employee that has a medical condition, which maybe prevents him from wearing hearing protective devices. We don't want a person with a tympanic perforation wearing earplugs, for example, or if it's likely to be aggravated by the exposure in that workplace. And then they also go as far to say what must be in that certificate of fitness. The certificate must indicate the recommendations pertinent to the fitness to perform the work, the presence of the occupational disease without including confidential medical information, if there's any restrictions or conditions, and the period for which this restrictions and conditions is applicable. And say, for example, this is something that can be resolved. The patient had tympanoplasty, and we now have normal hearing threshold levels, and this person can come back to work. The OMP, again, must do a certificate of fitness, not the occupational health nurse practitioner. And they say that the employer must, as far as reasonably practicable, accommodate the conditions and restrictions that's recommended and only permit the employer has been medically certified. This is the one I've just explained, to return to normal duties by the OMP. So the OMP must then see this employee again. The employer, again, must establish, implement, and maintain a documented system of medical surveillance. So again, putting the emphasis on the employer, and they must take into account the medical surveillance and medical screening overseen by the OMP, and at least include an analysis of the screening results over time and the use of the results for targeted exposure prevention in the workplace. So I think a lot of these things we have been doing, it's just formalizing it and make sure that we do connect all the dots. Remember, we have to have written informed consent. We spoke a lot about that in our Fit for Purpose workshop. The employee may also appeal a finding of the OMP to the Chief Inspector, and currently the Chief Inspector is Millie Ratus. And if you need her email address, just ask, we can provide it, and that person must do it within 60 days. So this is the code of practice. It is in that same document. Just scroll down, and then there's empty page, and then there's a cover page, and then you get to the code of practice. So just scroll down and look for it. And I'm not going to discuss it. I just wanted to focus you on page 7, the medical screening and surveillance. They talk about the audiometer. That's new. This was usually in the SANS. There's different types of equipment, the different types of calibration. They've specifically focused on the acoustic environment. And this is not a new thing, guys. The acoustic environment has always been in part of 10083. They are just focusing on it for some other reason currently. And I do know that the inspectors of the Department of Employment and Labour are specifically trained to ask you for your certificate of the acoustic environment. Then there's a new thing, the new old thing. Audiometric 0 and STS. We have done it in the mines. They are now bringing into under the Occupational Health and Safety Act. The big debate, and you must please read the newsletter that Joanette has sent out. I have explained a little bit on the AZ and the STS. We don't do, remember we've done under the previous, was it 2013 version of 10083, we have said if the PLH is 3.2%, we need to do X, Y, Z. If the PLH is 6.4%, we have to do a diagnostic. And if it's 10%, then it's compensatable. So they don't look at that anymore. The 10083 said we're going to look at RTS. And now the NAR says, no, we're going to look at STS. So we will go into more detail at the AGM. Then they've added an entry audiogram as well as an initial audiogram. I think the entry we've been doing for years now, they've just formalized it. And the initial is basically a periodic. It is the first one you do for a patient or employee if you've missed the 30 days cutoff for the baseline or entry audiogram. And then there's action criteria and reporting. What is a normal STS? What do you do if the STS is more than 10, less than 10, more than 25, less than 25? But we'll go into that. This is just the link. Right, so that is, sorry, a very, very brief, just a bird's eye view. As I said, we'll go into more detail at the AGM. Thank you, Joanette.
Thanks, Lindy. I'm going to hand over to you to introduce Dr. Casper. Then he can start his presentation. Welcome, Doctor.
Right. Okay. Dr. Casper, you've all met him. Those of you who were at the workshop on the 8th of August. And he's very passionate about occupational health. He's currently a third-year registrar in occupational medicine at the University of Stellenbosch, where he also completed his MBCHB in 2008. Following his internship and community service in South Africa, he spent over a decade living and working abroad and practicing medicine in South Africa, the United Arab Emirates, and Mauritius. His journey took him through more than 35 countries, offering him a broad perspective of global health systems and the diverse approaches to patient care. He's also currently the co-chair of the Western Cape chapter of SASOHN, and he's particularly interested in the intersection of technology, systems thinking, and OC health. And outside of his professional commitments, he's a passionate traveler. We can see that, reader, and a golf enthusiast. And he holds a level 2 golf rules officiating certification and lives down with his wife and 2 sons. So, Doctor, what I did, and I'm going to share my screen quickly. I thought, after your presentation the other day, I'm going to tell you. Now I can't remember the acronym. Is at LMM, LMS. I went and I said, ChatGPT, please, what is a good golf phrase to welcome the OMP as a speaker to our general online meeting? And they said, we're excited to have Dr. Casper, our OMP, teeing off today's session and driving us straight into valuable insights for our practice. And they gave me a little bit more options. And I said, no, we want it more professional. So it says, it's a privilege to welcome Dr. Casper, our OMP, who will be teeing off today's session with valuable insights. And I said, no, let's make it a little bit more playful, but still respectful. we're ready to get into the swing of things with Dr. Casper, our OMP, who sets to drive today's session straight down the fairway of knowledge. So, Dr. Casper, thank you for joining us. I really appreciate it, and I'm handing over to you.
Thank you very much for that amazing introduction. I just wanted to switch on my camera just to show that I'm here in real life, and that you know, I'm not some generated video, but for bandwidth's sake and just for the presentation, I'll switch it off now. Yeah, I think that's absolutely brilliant, and it seems like I'm almost not needed anymore, because it seems like you've got the swing of things for LLMs, and you know, on that note, may I have many hole-in-ones. So I'm going to just share my screen, and I'm sure you can see here that this is actually my landing page. Just generally, you'll see in the left-hand corner my email, then I've got my WhatsApp open and my ChatGPT. And this is not for show. This is literally how, you know, sort of in order of importance, how I open my tabs every day when I'm at work. You know, obviously communications first, and then my primary mode of sort of research and conducting business. And so you can see I don't even have Google open. But moving abroad or along, I will open up. I'm a stickler for keeping things organized, so you'll see that I've got my things there. I will just ask you, once this has opened and I've put it in presenter mode, and it should come up now. There we go. Can I just get a confirmation that you can see the slide? Yes. And that it moves forwards and backwards? Yep.
Perfect.
Perfect. Okay. So what I'm going to do is, you know, I'm going to try and move a little bit forward or faster through this particular presentation, because I want to come to some, you know, sort of practical aspects, because for me, really, I'm a pragmatist. I enjoy practicality. And this has led me to this very interesting path of intersection in terms of artificial intelligence and the healthcare sector. And for those of you that, you know, aren't quite familiar, it's just amazing the scope. This is already a couple of months old, but there's been 300 million weekly active users on OpenAI, and they are the company that owns or have created ChatGPT. And those 300 million users sort of roughly generated about 1 billion searches per week. And so we're talking about information translation and movement on an unprecedented scale. And Lindy has already introduced me, but I just want to say thank you. I'm Casper, and I am a registrar here at the University of Stellenbosch. And really, the genesis of this talk is, are you going to leapfrog the system, or are you going to be left behind? And I'll try and make the case in point that if you do not use artificial intelligence, then you are going to be left behind. And so really it's through that lens that I'm looking at this topic. I'm hoping to see more of these types of disclosure statements in the workplace. I've started using it in several of my several of my projects, and I've received quite positive feedback. As an academic person and somebody that's still busy sort of handing in assignments and research pieces, I have to disclose my usage of large language models to ensure that I don't fall foul of antitrust laws, as well as copyright laws, etc., etc. And so this is a really important concept, and I think we'll touch on it a little bit later, but I think it is important for everybody in the audience to really just take a minute and think about the ethical use of AI, and always disclosing it. One of the other examples is that when my patients sign consent, I now make them sign a consent document that includes a statement to the effect that I'm using artificial intelligence to draft guidelines, documents, etc. And so it's really a core principle that you be upfront with your audience and whomever you are interacting with, that you use artificial intelligence. Now, there's really been a lot of hoo-ha and a lot of pushback, and you've got proponents of artificial intelligence, and I really want to take the emotion out of this debate. I want to suggest that we neither think of artificial intelligence as morally good or morally bad, and that it is really just a tool, and that we have shaped our tools, or we shape our tools, and thereafter our tools shape us. And sort of baked into this idea is that if something is useful, it will be used. And I think that is what we've seen through the use of large language models and the massive uptake. It's so massively useful that it's been adopted at large scales. Nobody needs to advertise for it. Nobody needs to force you through documentation. There's none of those things that are happening, and people are just flocking to these sites simply because it is useful and it is a great tool. It is important that, just like anything else, when you are dealing with a tool or a specific technology, that you at least have some sort of idea of what we're talking about. And so artificial intelligence is this sort of very broad idea. And essentially all you need to know is that it's a system that mimics human cognition, and encapsulated in that cognition is reasoning, learning, and creativity. And so you get all these sort of types of learning, machine learning and deep learning. And these first two have sort of generated what we have come to know as large language models. And all that you need to know from all of this is, unless obviously you're interested in this, is that they use algorithms that makes statistical predictions on what should come next. And that is as simple as it is, and sufficient for most people to understand what happens. And then what they do with a large language model is they essentially just put a little skin over this algorithm. So skin, just something that you can interact with, and you can use natural language. You can type in, you can speak, and it uses natural language. The program or the skin will change that in the background for it to interact with the algorithm, and then it generates an answer in a statistical manner, but then the skin will then retranslate it into human text or phrase or something that you can understand. So I think it is important, though, to start getting the nomenclature correct, and not just sort of homogeneously refer to everything as AI. AI has got very specific meanings, and then we are focusing on a specific part of AI called large language models. And so in occupational medicine, especially in Africa, and here you guys will be the experts as opposed to me, what are the problems that we're trying to solve? Well, I've highlighted 4, but there's innumerate amount of problems. But essentially, we're dealing with a fragmented, or even a lot of times a non-existent occupational health system. We have so many examples of workplace injuries and diseases that go underreported or undertreated. We don't have a lot of expertise. I would love for somebody to chip in and just tell me how many OHNPs there are that's registered in South Africa. Again, in terms of specialists, there are sort of roughly about 50 registered in South Africa. So woefully scarce skill. And then we all do our own thing. Our data is siloed and non-digitized. Just think of all the paperwork that we all deal with. And I'm sure that you guys deal with paper trails still today. Is there anybody that knows how many OHNPs there are registered in South Africa? Any Do we have any idea of that figure? Yeah, doesn't seem to be the case. Oh, yeah.
Doctor, the last time we talked about it, it was just over 3,000, as far as I know. Not all of them are members of SASOHN, but registered or the SANG receipt indicates
Okay.
just over 3,000, which
Right.
is a drop in the bucket.
Yeah, exactly. You can go and do the maths. I think some of the policy, some of the literature I've read, if you start looking at 15, 20 million people in sort of employment, then, you can start making the math and see that, it's sort of a drop in the ocean. And here's just some more statistics from across the continent about the fact that we are woefully underrepresented in occupational medicine. And by the way, although the statistics are better in Europe, it's not much better. So we're dealing with a scarce, finite skill. And so why are we using AI? And specifically large language models. And the reason for that is it presents a unique opportunity for us not to go through all the developmental stages slowly, but really to leapfrog all of these and start right at the beginning or right at the top, and sort of skip all the sort of learning that has had to happen over the past 100+ years. And so we do that by bypassing costly infrastructure and as I mentioned, scarce specialists, skills and systems, and we are able to deliver smart and scalable solutions. And that word scalable is really, really important. You can sit in your office in Cape Town and deliver specialist services up in the Northern Cape if there is a working internet provider there. And so really the argument that I'm making rests on three legs: the legislative, financial, and the moral or ethical leg. And essentially all that you need to know from this slide is that people are predicting that AI is going to influence the GDP of countries like no other technology has ever shown before. And it's not always easy to explain to people the magnitude of when they talk about doubling a GDP, but that is just unprecedented. If you think of the fact that I think by the latest statistics, our economy is growing at something like 1.8% per year, up to 2 if we're lucky. So doubling that in a question of 10 years is just unprecedented. We know that occupational health interventions already have a nice return on investment. Some of the figures quoted shows that for every dollar, or you can sort of translate that into a rand spend, you get somewhere between 2 and 4 dollars return. I've seen studies show up to $6 return. And this is going to even be amplified, by artificial intelligence and specifically large language models. We're going to optimize our workforce, we're going to enhance workplace safety, and we're going to drive economic growth. So there's really no sort of debate about the financial reasons to use it. Legislatively, we haven't seen definitive legislation on artificial intelligence yet, but I suspect it's not far off where we're going to see mandatory use of artificial intelligence in specific circumstances, and most certainly with a combination of expertise and artificial intelligence usage. And so this is a sort of a ever evolving space, and perhaps just to say that this is the area where we're also lacking the most. But then the moral and ethical reasons for using artificial intelligence and large language models. And this is really where the passion comes from, and why I like to do this talk is to show people, or at least to show them how to use and sort of utilize the technology to the benefit of their patients. Because at the heart of it all, I believe as healthcare workers, we're all interested in really getting the best for our patients. And so how do you do that when you are faced with constraints in terms of access to speciality, resource constraints in terms of finance, etc., etc. And the reality is that we are dealing with some of the most vulnerable individuals in our working society. We know statistics from the mining and agricultural industries that they are particularly exposed to occupational risks. We really uphold the human rights and the dignity of all the workers by ensuring that we are compliant with the legislation, and we ensure that they are able to access those pieces of legislation. And then, of course, ultimately, all of this leads to the enhancement of worker safety and preventing of harm to our workers. Imagine if you can generate policies, guidelines, SOPs in such a way that it makes it easy for the management to adapt and adopt your ideas. This is just, a funny little slide that talks about this future, and you'll see some of the quotes says 2025, and some of this has already come to fruition. I think the long and the short of it is there's a lot of scaremongering about how we're going to see a lot of job losses. Essentially, what seems to happen is that there's a net job creation. However, jobs are changing. And so it's either you're going to know how to combine the use of artificial intelligence and LLMs with your current set of expertise, or you are going to be sort of replaced. And so I think that's really important. I'm quickly going to run through this area, this slide, and essentially just touch on where we see artificial intelligence used today. Well, most of you will be familiar in terms of the LLMs, ChatGPT, Claude, Copilot, Gemini, and the reason Grok from Elon Musk. And the reason why I'm mentioning all of those is it is actually important to not just be stuck on using ChatGPT. And I'll explain to you later, and from a practical point of view, why you want to know and have access to several of these. And we'll also show you practically what they can do. There's lots of machine learning built into programs already that we don't even know about, but this is typically on the back end. We know that some of our radiologist colleagues already use what they call computer vision systems to detect and help with abnormalities on imaging. Also, we see this in the dermatological space where they are using AI to look and evaluate moles and mole mapping and also all sorts of rashes, not just moles. And then also we see artificial intelligence in the monitoring technologies where we're using smart devices, remote patient monitoring. So I know of cases where there would be remote monitoring in some of our rural hospitals, and that gets relayed back to the specialists in the city. And then, of course, medication adherence. So there's all sorts of tracking happening already on a daily basis. What can you use this for? Well, mostly people will use it in terms of improvement for their efficiency and accuracy. So clinical documentation and reporting, it can help you make clinical decisions. It can ensure that you engage with your patients a little bit more actively. So there's sort of a whole wide array of applications. And so I think this quote from Satya Nadella, the CEO of Microsoft, holds true, that it is really the defining technology of our time, and it's going to transform everything, including the future of work. And for us as practitioners in this space of work, I would argue that it is going to be critical that we have a better than most working knowledge on artificial intelligence. Again, I'm not going to go through all of this, but essentially you think of it, AI can help you in creating more efficient ways of dealing with whatever problem you are struggling with. I think this is a very important slide, and I will just take a little bit longer on this to go through this more in detail. So as with any tool, you need to know its sensitivity and its specificity. You need to know what it is, what it can do and what it can't do. And I think here it really is important. You need to understand that artificial intelligence and specifically large language models have a data bias and they may answer questions in an unequal way. I would just say that despite that data bias being there, it's not worse or better than the real data, because whether you go and look at the data in a library or whether you ask the LLM to help you with the data, the bias will still exist. So that's an inherent data bias, and so it's just important to be aware of that. Diagnostic errors, I would certainly be very careful in terms of how I phrase my questions with regards to allowing AI to just diagnose the problem. So I think that's something that one must be aware of, especially the so-called hallucinations. Privacy breaches, I'm very particular on how I use my artificial intelligence and making sure that I put in mechanisms to control the privacy. Ethical dilemmas, well, that's up to everybody to decide where their moral compass lies, but it is important to just give thought to potential ethical dilemmas that may come up. And surveillance overreach. At some stage, there is a place where we need to say, sometimes more data, more information is not a good thing. I do not want my employer to know what I'm doing and how hard I'm working and how actively I'm working 24/7. And I think that we will be the custodians at this forefront. And I would encourage you guys to push back, especially when you see an overreach, and say, is this inherent, this technology, is this monitoring what is an inherent requirement of the job, or why are we doing or bringing this particular technology into the workplace? And I think that will be very important to ensure that you still have the trust of the employees, and that's a trust that we build up over long periods of time, and we should cherish it. So as with as you would be used to, this is also very important. Which mitigation strategies are we going to implement in our use of LLMs and AI to make sure that we negotiate the risks that are involved? Well, I always de-identify patient data. So I strip out all direct names or indirect identifiers that can be used before I ask the LLM to do something. A practical example would be, I would see a particular person in my clinic, and then I would say, I wouldn't even necessarily give it a specific age. I would say 50-year-old gentleman works in the plumbing department of a tertiary hospital. This person was exposed to these biological agents. What should I do? Or this person struggles with mechanical backache. Please write a referral letter. And then afterwards, I'll go and fill in the names. I'll fill in my name. I'll say, works at this specific hospital, etc., etc. So it's really important to do that. There are certain settings that you can also toggle and play with, but again, then you are leaving that trust into the authors of these technologies, and I would rather make sure that I hold that sort of responsibility. I've already touched on transparency with patients. My informed consent now includes a paragraph to the extent that I make it aware that I use LLMs to write my reports and to compile my referral letters. And so patients sign when they see me, knowing that that is the set of tools that I use. Human in the loop approach. This is such an important thing. You cannot take the human out of the loop. And this is very much on the lips of everybody in the international scene who speaks about artificial intelligence and large language models. You are still the expert. I'm going to say that again. You are still the expert. And so whatever piece of material gets generated by the large language model, you need to sign it off, and you need to be comfortable that you understand what is in that document and you will stand by it. Remember, an LLM and an AI, they are not natural people in terms of the law. They cannot take responsibility or legal responsibility. Ultimately, it's going to be you. Then you must implement strong governance and audit trails. So there must be a clear policy in your department on how you use LLMs, who can access it, why do you use it, what for, etc., etc. And then, of course, ongoing education. I spend not an inordinate amount of time, but I spend at least, I would say, let's call it 45 minutes a week, just browsing YouTube, looking at what is the newest sort of gains, what are the newest applications, who are the new technologies on the block, and that just enables me to hone this tool and sharpen my use of it, and that really does make a big difference in terms of the practical application. Some of the interesting sort of news snippets that I've highlighted here, you can see that's from April 2025 and from February 2025, so fairly new sort of headlines. And it really just shows that, especially in the medical field, the use of AI is really becoming much more frequent and much more accurate. However, there's going to be, however, to extract the maximum value, you're going to need to know how to use AI. And that is reflected in NVIDIA CEO's quote here. So the question I want to leave you with is, whilst you're sitting there, are you going to be leapfrogging the developmental stages, or is it time to pack in, and are you going to be left behind? And that really is a question for each and every one of you. I invite you to connect with me on LinkedIn, and I will sort of just show you something that I've prepared in terms of a practical application and how I use this every single day. Before I go to that part, is there any questions? Any questions thus far? No questions. Sorry, I can't see the chat or the...
Yes. I don't see any questions on the Q&A, or let me just check the chat. Okay, guys, is there any questions for Dr. Joubert? No, I think you've asked and answered all the questions.
All right. Now, the next question is, can you see my landing page here in terms of ChatGPT?
Yes, I can. There's one question, Dr. Joubert.
Yes.
Any preference on which AI to use?
Yes, that's very important. You have to use all of them, and I'll show you now.
Okay.
You have to use several. That's very important. Okay, so because they constantly change. So I think maybe it's a good place to just say here that GPT is a generic term, and it stands for generative pre-trained transformer. And generative meaning it will generate something. It's pre-trained. So unlike what most people think, it's not continuously learning. There's clear cutoffs. and a transformer just means that's the type of algorithm that they are using. And so there's many GPTs. We've just become used to the sort of brand name ChatGPT. It's worth noting here that I've got the paid version because I've used it so much, or I use it so much that my whole workflow, I couldn't not use it anymore. And so I got frustrated by the restrictions to the point where it's so integrated and embedded into my workflow that I decided to pay for it. And this is probably one of the first things I've ever paid for in terms of software. Here you can see my whole library of like how I use it. I mean, there's just nothing that I don't use it for. Anyway, so I thought I'll quickly show you something that it can that it can do, and the type of thing how I use it. And there's a few very important principles here. I didn't know that you were going to use the example of the noise induced hearing loss regulations, but I thought, let me show you something interesting on this. And so, as I showed you, I like to use, or I like to be organized. So there's my SASOHN. So there's the meeting. So here, I've got the 2003 regulations, and I've added it as a document. Now I add more. Okay. Now this is the 2024. Okay. I'll see if the dictation button works. If it works, that will be even better. So, and listen to how I speak to it, because as strange as it sounds, it's very important. So, pretend to be an occupational medicine specialist as well as a legal expert. Also have a professional understanding of noise and the health effects of noise. Please review both of these documents attached and draw up a comparison of the old regulations as compared to the new regulations, with a particular focus on the aspects that is important for me as an occupational medicine practitioner to be aware of, and where reasonable, include short definitions of the concepts discussed, such as threshold shifts, etc. So you can see there, dictation, you don't even have to type. Most people can talk much faster than what they can type. So there you go. It's got that. Then I just say enter. All right. And now you can see it just starts spitting out answers. Okay. And so it first looks at the 23 regulations, then the 24 regulations. Now they talk about the exposure thresholds. There you can see limits of 85 decibels. Now they're talking about the 2024 has got 2 thresholds: noise rate limits, noise action levels, etc., etc., etc. And it just keeps on going and going and going and going. So this is the type of power that these engines have. And I think this is just one small aspect of what can be done. There's little bits of concepts and definitions, and it will give you a summary table so that you can just quickly go and have a look at this. All right. So now, now you can say, okay, using the 2024 regulations, consider the following situation. I am the occupational health nurse practitioner for a small company of less than 10 individuals. It is a owner-operated company They manufacture furniture and they're situated in a rural part of the Western Cape. Please draw up a simple, practical, yet legally compliant hearing aid or noise regulations for this company, as well as a medical surveillance program that I can institute. So, sorry, I should have said conservation plan. It just escaped me, but that's okay. We'll just, and then there we go, and it starts writing this. What we're talking about, the purpose, the scope, you know, what are we going to do? How are we going to maintain it? What are we going to do? And it's just generating all of these things. And I think, well, I think you can all see the types of value that you can derive from this type of thing. One of the other very important points to make here is that you need to understand prompt engineering. You need to understand how to ask the questions, in which way to ask the questions, and what words to ask the questions, okay? Or how to frame, you know, which words you're going to use when you're asking questions, because it will give you different answers depending on how you use it. And so that is called prompt engineering. And so you can even ask, if you don't know how to prompt it, then you can ask, please help me with the best prompt using the 2024 guidelines to generate a medical surveillance program and a hearing conservation program. I would like you to only give me the best prompt to do this. So now it should kick out the best prompt that I'm going to use. And there it is. So the prompt, there you can see how it, so you can see that I've done this now enough so that I know which words to use. But here you can use the prompt, and now you can copy and paste it. And now you can say, using this prompt, do what I've wanted you to do. And so that is very, very important. So this concept of prompt engineering, I cannot emphasize this enough. All right. Now, previously, there was another question on which ones do I use. So I use several. You can use Gemini. Okay, Gemini is a free one. It's part of Google. I do have a plan with them as well. You can see there, hello Casper. I do not have the pro version of this. I just use the free one. Then there's so many. I also have a Perplexity AI. So that's another one that I use. There you can see my, I'm already signing me in because I use that a lot. And I will flip this around. I will ask the same question to all three because they are not all the same. And they constantly update their models, which means that they will constantly, one will be better at coding, another one will be better at report writing, etc., etc. And then another little trick that is very valuable is once you've developed your program, then you attach your program and you say, I have developed this program. Please critique my document looking at X, Y, and Z. And so that's also a very practical way of doing things. The other trick that I use to sort of create these guardrails is that I will go and search for the documents. I'll do a literature search. All right. And you can use the LLMs to do that as well. But let's say you've got a nice PDF document or several PDF documents. I'll go and search for them. Let's just do a Google search. All right. So just say hearing conservation program. All right. Now you'll see there's several OSHA. You can even do, let's say, an HSE. Let's see if the British standards come up. HSE. And I'll go and look for, there's a NIH one, Ohio State, etc., etc. So I will go and download. There's British Petroleum's hearing conservation policy. There's a one for the Canadian Center. So I'll literally go and I'll go and download all of these PDFs. So quite simply, and it should, I don't know why it's not downloading, but anyway. Okay, well, I'll open it up and I'll download it, and I'll have 4 or 5 of them in a folder. Okay, so here's the whole thing, 7 pages, and I'll download it into a folder, and then I'll go and upload all 7 of those PDFs, and then I'll say, considering this is South Africa, use these 7 or use these documents that I've uploaded and generate a best practice hearing conservation program based on these documents. So now you know where it's getting its information from. It's not just pulling it out of thin air. And there's other uses or other types of AI. There are brilliant note-keeping AI. So where you put your cell phone next to your table and you have your conversation and your consultation with the patient in Afrikaans or English or whatever, and it will, as you talk, it will capture it in a medical sort of format, in the SOAP format, and then you can say, generate this report, generate that report. There's all sorts of other things. There's different types of GPTs. So this is logo. So you can say, I need a company logo. I am a occupational health nurse. My name is Betty. Please develop a simple professional logo for my company. Okay, and you can see my spelling have gone down the drain because it's not really that important. And now it's gonna start rendering a little, picture, and it usually takes a little bit of time depending on how busy the site is. But it will do its thing, and hopefully, if it doesn't, hopefully it doesn't take too long, but it will eventually generate a nice little logo that you can use, and that's that's sort of just some of the power of what these things can do. And so perhaps it's a good idea, whilst this is generating in the background, if there's any other questions, I'm happy to take that. Particularly, the idea for me here is to show you practically how I integrate it every single day. I write. There's nothing that I don't use this for. Almost no email goes out. Almost no LinkedIn post of mine goes out. No policy is untouched that I draft. None of those things. I always use ChatGPT, and it just enhances and creates a much more efficient, sleek-looking product. So yeah, I think that's pretty much what I wanted to say. Is there any questions?
Right, so no questions in the Q&A, in the chat part. No questions. We've got a comment from Petronella. Great presentation, Dr. Casper. So that is great. Thank you.
It's just taking, unfortunately, I would have wanted to show you my logo, but it's now taking a little bit too long. But any case, you get the idea. It's not bad, actually. It's pretty good. There we go. There we go. So yeah. As as we, and you can say make it more artistic and all the rest of it, but at least it's a nice start. And now you just copy and paste that, send it off to the printers, and you've got something that's workable. So yeah.
Okay, there's some questions coming in. Dorothy asks, what about plagiarism in AI?
Yeah, so okay, I'm just gonna stop sharing. All right, so the reality is that there are some companies that are starting to push back on plagiarism. The problem is that I kind of don't see that being an issue in terms of they're not going to be able to stop it. The horse has bolted. So, and because you are also using it's generative. So I think that's important. It's not searching the internet and taking little snippets of of text of people. That's not what a GPT does. It was trained on billions and billions of data points up to that time, and then when you ask it a question, it integrates all of that knowledge, and it then predicts or produces an outcome. Now, if you are dealing with a academic piece of work, you're still going to need to show your resources. You're going to have to reference it properly, etc., etc. So when that is applicable, you're going to have to still follow the same rules. But I don't see it being a problem in that sense of plagiarism, because it's not really plagiarism. It is a fine line, but but I'm not we'll obviously have to keep an eye on this space, but I don't think that's going to come to anything.
Okay, there's two more questions. Are there any apps that you use regularly for occupational health?
There are no apps that I use regularly, apart from just generally my large language models. There's a few reasons for that. Please remember, I'm in an institution where I am restricted by the codes and policies of their IT department. But what I would say is, if I was in a high volume clinic, I would say that I would probably look at something like Heidi, Heidi, Heidi. That's the note-taking app, and definitely explore that part of it. And this is a bit higher grade. This is even, yeah, well, it's the next frontier. There's something called AI agents, and I'll leave that for everybody to go and research on their own. But the space has moved on from LLMs. Nobody's really talking about LLMs anymore. But an AI agent, in short, is something that can interact with a variety of your programs. And so if I was in a high volume clinic, I would get a tech savvy person with the protection and the blessings of the organization to build me an AI agent that can look at my electronic health records and that can automate a lot of my work. So I'll have Heidi that captures my consultations. Then I will have this agent that accesses my Heidi and then accesses my electronic records and populate all of that and generate my certificates of fitness, etc., etc., etc. Obviously, you're going to have to make sure that you've got robust SOPs, policies, and guidelines documents in place, and also need to make sure that you educate yourself in terms of information technology and the protection of people's information. But that's what I would have done.
Okay. Then John asked, to what extent can information from ChatGPT be used without referencing?
I think you do that at your own peril. It depends on which level are you asking the question. When I use it to present and to inform my presentations, I check every single reference it gives me. I have documents and documents and documents of PDFs where I download it. If it makes a statement and it gives the reference, I download the PDF. I first look that it works, see that the PDF is actually there, it works, and I will then sort of give it a quick scan. And if I can't find it or it looks like it's off topic, then I won't even include it in my talk. I throw it out. But that's for my academic talks. For just having a quick understanding of what is meant by fitness for work in this context. No, then I don't check the references. I use, remember, you guys are experts. You have many, many years of experience in the field. And so AI and specifically large language models should not replace common sense and should not replace the need for thinking through the problem. It's not going to take your thinking cap away. It's going to take the schlep away. That's what it's going to do.
Okay, 2 more questions. Is it true that you should not be using your company name and other personal details when using AI to write anything for you?
Yeah, I would not do that. I would rather say company A or company X. You do have settings, and especially ChatGPT, you go to the settings bar and you can toggle the information, how they deal with your information. But again, once you've typed it on there, you are trusting the company to deal with that information in an ethical manner. Now, I will say that there's a lot riding on this. And so I would say that mostly the use case is keeping these companies honest, because these are billion-dollar industries. So the fact that they literally can't afford to be seen to be unethical with your data, but I still wouldn't trust it. And I always like this topic because I love how, and I'm not saying this is your case to the person stating the question, but I love how we get all excited about our data when it comes to something like this. But when we log on to Facebook, or we, or we click on an advertisement, or then suddenly we've forgotten all about cookies and how these things work at the background. So yeah, I mean, we all use apps for the free coffee at at Vida and all the rest of it, and so yeah, I think it's also sometimes a little bit silly to get over paranoid about data protection.
And then can one enter vital statistics and symptoms to identify an illness? Is it being used, and how legit is this?
Yeah, you can. Well, you test it. But yes, absolutely. The paid versions are better than the free versions. But again, this is where prompt engineering comes in. And you're quite correct already. There's one part of left diagnosis out. So that's part of the prompting. But I would frame it differently. I would say I've got these vitals and I've got these test results. I have thought of X, Y, and Z. What am I missing, and what should I consider? And I would say you're going to get a pretty decent answer. I would say you're going to get a pretty decent answer. At least that's been my experience since moving from ChatGPT 3.5 to the 4 version and now to 5. I'm seeing much less hallucination. So where it's making up things, I'm literally just, I haven't come across that in a while.
Okay. Oh, well, wonderful. I think it's a whole new world, so many possibilities. But I do think, and I do concur that the prompting is very, very important. I think AI learns us how to communicate and ask our questions correctly.
Yes.
When
yes.
we look at the response at the beginning. So hopefully we can communicate better in future. So Dr. Casper, thank you for presenting AI in occupational health. We really learned a lot, and we really appreciate the time. Before you go, I want to share my screen quickly. I'm going to show you, and I'm sure you know this app. Suno.
I don't know Suno.
You don't know
You,
Suno. So
you're
Suno,
teaching
you
me.
prompt. Yes, great. That's good. Then I can teach you something. So Suno creates songs. So I've created this for a pitch for our conference. I'm just going to play a little bit. I'm not going to play the whole thing. Can you hear?
No.
No, we can't hear. When you share, you must click the button at the top that says include computer sound. So
Where
just
is that
unshare and
button?
share again. It's right when you click
Stop.
on the button share,
Yeah.
it will be right at the top.
Include sound. Okay, perfect.
Yes.
Kyk nou, sien leer ons mekaar iets. Share. Okay, let's go. Let's do it again.
In a Santa suit, our conference starts. Health and safety filling our hearts. Nurses unite, let's lead the way. Preventing harm every single day. Santa's got his list, checking twice. The pain, healthy workplace we will sustain. SASOHN Western Cape, unite. Leadership shining so bright. Injuries and diseases we fight. With the jingle bell joy tonight.
Okay, so yeah, you prompt them some words and you choose the genre and it creates for you some music.
Fantastic.
Yes. Right, so that's all then from us. Thank you, Dr. Casper. Jonette, I'm handing over back to you.
Thank you, Lindy, and thank you, Dr. Casper. It was really, really interesting. I thought I'm using ChatGPT a lot, but obviously underestimating its abilities. Okay, everybody, I've got 2 more questions to ask you. If you just hang on just bear with me for a second. I'll launch those 2 polls. And I encourage you to please vote or participate in the polls. I'm asking the question, will you be able to attend the AGM? This is not an RSVP. It is just to give us an indication of how many people are interested in attending the AGM. So please participate if you can. Okay, that brings us to the end of the meeting. Thanks again for joining us. It was great to have you here. At one stage, we had over 60 people in the meeting, if I remember correctly. And we are really driving the totals for our meetings. Thank you, everybody. You can leave the meeting. If I can just have the committee stay behind. We're just giving the people a chance to vote, and then we'll start removing. Let's give them another minute. Okay, thank you, everybody. Lindy, this was fantastic. Thank you so much. It was really, both presentations it was really good. Thank you for that. Is there anything else that you want to mention while we are together? Any of you?
I can just there are 4 people in the chat. They are out of the meeting? No, sorry, I'm just.
Yes,
Okay.
I removed everybody.
Oh, okay. I can just maybe say that professor that has confirmed now while we were in the meeting that he will do a talk on emotional intelligence.
Wow, that's wonderful.
Yeah.
That's wonderful. I'm looking forward to the AGM. It's going to be great. Thank you for arranging that. I don't think there's anything that we need to discuss urgently. I will share the recording. Joan asked to share the recording. I'll post it on YouTube like I usually do, and then I will send the link on the group for anybody to listen to it. Okay. Thank you again, Lindy. It was really
Pleasure.
good.
Thank you, Lindy. It was really good.
Glad you guys enjoyed it.
Mhm.
You must use ChatGPT.
Oh, we do.
Learn how
And
to use it.
Copilot. Perplexity, not so much, but I like Copilot.
Perplexity gives references, which is nice.
Yes. Yeah, I should
Yeah.
use it more. Copilot's a little bit more informal. I think of the ones that you should use for an assignment, Perplexity is probably the best one. Should use it more.
No, we must make our work easier.
Definitely.
Okay, guys.
All right. You must have a wonderful afternoon further, and we'll see you on the 10th.
Dorothy says her sound is not working. You guys must remember of the visit on the 5th at Hotel Verdi.
Yes, yes, yes. I put it in my calendar, and yeah, you must just indicate which venue you want to go to on the 17th. I'll post a poll, and then you can decide. Okay, everybody. Thank you a lot.
The 10th.
We'll
The 10th,
chat
not
again.
the 17th.
Say again.
Okay. The 10th.
Yes, yes.
Not the 17th. Okay. The 17th is the
AGM. Yes, I'll see you on the 10th. Sorry. So Freudian slip.
Okay, guys. See you then.
Have a good afternoon. Bye-bye.
Bye.
Bye.